Welcome to everyone joining tonight. We're very glad that so many people have come along. I'm going to introduce Sandra Pires to you, and Sandra is a research nurse, and Sandra, well, she'll tell you a bit about who she is in her talk, but Sandra works between Southampton and Portugal, which is probably an unusual combination, so I think she'll probably tell you a little bit about that, and Sandra's here to give us an overview of current Huntington's research, because as we know, there's lots and lots of research going on, and sometimes it can be quite difficult to get an overall picture about what's happening. Sandra, do you want to share your screen?
Yeah, thank you, John. Good night, everyone. I'm Sandra, so hopefully you're all here for to hear about research in Huntington's disease. So I will be talking a bit about myself, but just very shortly, so that you know why me delivering this presentation, and then I'll go through what we know already from research and the current research that is happening and how are we moving forward. Talking a bit about myself. So I sort of wear 4 hats. So I'm a nurse. I've been a nurse since 2010. I graduated in Portugal, and then I did a master's in palliative care, and then I moved to England in 2014, where I've worked as a research nurse and sister in neurodegenerative diseases at University Hospital Southampton. And academically, I did a couple of fellowships and awards, and I started my PhD at University of Southampton with a scholarship from 2020, and God knows what that's going to finish, but no one's counting, of course. So I am part of a few groups, which I'm going to call like a multisectoral stage. So I've been collaborating with the Huntington's Disease Association, with the European Huntington's Disease Network, and then I have some connection with the palliative care associations, both in Portugal and in England. And personally, I have a huge family. I have 21 direct cousins, and I bet, if anyone has more than me, put it on the chat, because I'll be very interested in sharing experiences about how to manage so many cousins. And as John said, I've been basically dividing myself between England and Portugal, but just since last year. So that's when I returned home, or Portuguese home, and now I don't belong anywhere. And in the picture, that's my little daughter, which I'm hoping she does not make an appearance, but this way you can have a glance at her beautiful face. So anyway, my first message today is that care and research need to go hand in hand. So, and this is to say, I know everyone cares a lot about research, new treatments, new cure, and new cure really. And the most important as well is the care at the present. So being able to access resources, the right facilities, the right professionals. So although research is very important, caring for the present as well is very important. So hand in hand, one another. So Ed Weil, the famous words, Huntington's disease, the most curable, incurable brain disorder. And why did he say that in 2016? That there's the paper if you want to read it. It's because we know what causes Huntington's disease. So if we know the cause, it's easier to find the treatment. Now, it hasn't been that easy, and I'll explain why in a little bit, but we all remain very hopeful. So what do we know so far? So we know the gene that causes Huntington's disease, which was found in 1993. This is the only data I have for you. This is not a history lesson. So we know it causes a mutation, which produces the faulty Huntingtin, which accumulates in the brain and causes the symptoms that people have with Huntington's disease. So we know this Huntingtin needs to be slowed down or reduced somehow to make an effect on the symptoms, or like make a difference on the day-to-day. And we know there are drugs that are approved to manage some of these symptoms. For example, to manage depression, to manage chorea, there are drugs available. And then we know that healthy lifestyles are good for your brain, not just the brain with Huntington's, everyone's brains. But the fact is that in some of these neuro conditions, exercise makes no difference, such as motor neuron disease. While with Huntington's, exercise and having a balanced diet and cognitive stimulation is proved to slow down the progression of the condition. So there's been quite a lot of disappointing news in the last, let's say, 2 years. But why should we remain positive? Because every time we do a trial and it doesn't have the outcomes that we would hope for, we learn something with it. So for example, with Generation HD1, which was one of the biggest trial in Huntington's disease that enrolled more than 800 participants worldwide, we have learned that we can run clinical trials at a large scale when we know we can lower Huntington. And so we keep trying. Let's see how we can make an effect on people's lives. So HD Trial Finder. So I'm not sure if you're familiar with this, and I'm a bit scared of stop sharing my screen, but this is sort of like a screenshot of what you're able to see. So when my presentation goes around, you'll be able to click on the hyperlink. And HD Trial Finder is basically a website where you can hover the country where you're at, just in case you're not based in England or in the UK, sorry. So in this case, at the moment, it says there's 6 ongoing trials in the UK, and this is the list that shows up. And I'm gonna go run through these studies next. But basically just to say that you can keep track of which studies are running close to you. So these are the types of the type of research I'm gonna run through today. So I'll start with observational studies, and then I'll move to Huntington lowering, gene editing, somatic instability, and some specific symptoms research. And I'll explain some of these words. Again, where it says here, current research, these links to Huntington's Disease Society of America. And for people that are interested in research and they want to see like what types of studies exist, what phases, if they're running or if they've been, canceled because they didn't have the expected outcomes, you can visit this page, and it will tell you like quickly, like in a little table, you can see everything. And sure, do I dare? Like, I'm gonna dare because I'm brave. Just to show you what it looks like. So this is the website I was talking about. It explains to you the types of studies, but this is the pipeline. So basically it goes from basic research, like preclinical, to the later stages. So hopefully you can see it now. So for example, you can see that tetrabenazine was approved. So the ticking box means it's an approved drug, and so on. You can run through it at your will. So changing back to presentation mode. Okay, so observational studies. So you probably have heard about Enroll HD. I think this has been going on for decades. It's like a natural history study, and it collects information about the disease progression. So you can take part on Enroll no matter the stage you're at in the condition, and carers as well or partners can take part. Then Shield HD, I'm going to talk about it in a bit, but basically to understand that this is a study that's targeting like somatic instability. So basically when a person does the predictive like genetic test and it gives them CAG repeat, what the amount of repeats they have. Actually, through these observational studies, we've realized that the number of CAG repeats can vary depending, even within the brain or, different organs, it can vary. So what Shield HD did was enroll a bunch of individuals and keep track on their CAG expansion. I'll go into it in a bit, but basically it's a really relevant study. HD clarity is looking at Huntington's disease biomarkers. And then we have integrate HD, which I'll talk in a bit. So this is one of the things we found out from these natural history studies, from these observational studies, which is quite valuable. So these observational studies have allowed us to start research in people earlier. We have a new staging system for Huntington's disease, a new classification, which basically says, you have a positive predictive test, you have Huntington's disease, that's stage 0. And then it divides into 3 stages, depending if you can only spot it on biomarkers, like in the lab, if you can see some signs of it, or if it actually translates into your day-to-day activities. So then, if it translates to day-to-day activities, it divides into mild, moderate, or severe. But basically, what this allows us, and what we want in the scientific community, is that people are allowed to enroll on clinical trials earlier, because we know that before the motor symptoms start, there are already changes in the brain, cognitive, behavioral. So we want to start the drugs as earlier as we can. So that this has been quite relevant to accelerate our learning in Huntington's disease. So next, integrate HD. So this is a study I'm leading on as part of my PhD. This is my first PhD study. And as I said, research and treatments are important, but improving current care is important as well. So if you want to have some fun, I'm looking at ideas for a logo for the study. So if you click on that link, you should be able to vote on a poll that I have currently open. And I think if John can pop the link on the chat, that would be great. And so why did I started with this? This is a message from Alan Adams. He's one of my patient public contributors on the study. So I've been quite keen to involve people that actually have the experience of living with a disease. So although I'm very keen to improve care for Huntington's disease, I don't come from a family affected by Huntington's disease as far as I'm aware. So it really keeps me grounded having people involved. So we're talking about care fragmentation with Alan, and Alan said that the field of multidisciplinary care, there's total chaos, and that it's all do it yourself. So he was talking about the never-ending battles between health and social care. And I don't want that, people living with such a complex condition that have no time, even for, to have a rest, and still having all these struggles and to fight for care is just not fair. So again, discussing with my patient public group, we're saying there's so much done already in other conditions, such as care and dementia, that seem to be more visible. So let's find an even ground for Huntington's disease. So I've opened the Integrate HD study on the Rare Disease Day on the 28th of February. The survey is open to anyone that wishes to take part, so long they're an adult and they're people, at risk of Huntington's disease, someone with a positive predictive test, carers or former carers if they have cared for someone in the last 3 years. So what I want to know is, what does integrated care look like to meet the needs of people living with Huntington's disease in England? And for that, I need to start from where, at what level are we, so that I know what to improve. And if then I apply an intervention, I have something to compare it to. So if you can help me identify the gap between the care that is provided and the care that you need, I really appreciate that, and map the differences across England, because I can see that certain locations have a lot more access and help than others. So I'm not going to go through the questions for the survey, but basically just to tell you that it's been developed with people that live with the condition, and focus on these 4 quadrants. So if you go through the survey and wonder, why is she asking this? This is all I want to know. Do you have access to expert knowledge? Do you consider your care person-centered, like, focused on your needs or your family needs? Is it coordinated, and does it have continuity of care? And again, the questionnaire was developed with HD Voice, which is a PPI group for the Huntington Disease Association, and my own PPI group that I had recruited for the study. So moving to Huntington lowering studies. So we want to lower that like faulty Huntington. So there's good Huntington and there's like the faulty Huntington. Huntington lowering studies, I think they're like the most prevalent ones. They aim to reduce the levels of the faulty Huntington protein in the brain with the goal of slowing or stopping Huntington's disease progression. One of the biggest ones, as I said, generation HD1. Now, generation HD1 did not have the outcomes we expected, but actually they did lower Huntington in patients. The issue with generation HD1 was that the higher dose, so patients were on different doses, and the higher dose actually made the patients worse. But in the lower doses, it showed, it seemed to show benefit for some of the patients. So Roche, which is the company promoting this study, has now done the subsequent study, Generation HD2, which is a phase 2 study, which means, you know, they're testing it on people with Huntington's disease, but a smaller sample. So they're doing 360 people aged between 25 and 50 with early manifest HD, so like very early signs of Huntington's disease. And they'll be administering the drug, which is called tominersen. And these are the doses, 60, 100, every 4 months for 16 months, and placebo. So basically, this drug is administered by lumbar puncture, so which means they put a needle in a person's back and they administer the drug. So for people that are on placebo, they sort of like pretend to administer it. So if you want to look at the site where this is going to be open, you can again visit here. And I just thought it was important, you know, from what all that I read and heard about Generation HD2, to let you know that people that were dosed in Generation HD1 will be excluded from this new trial. And the reasons for that are long and complex, but you can look for more information, you know, in case you are one of those people that are affected by this news. Please look up for more information or contact your site that delivered Generation HD1. So I'm not going to go too much into lab research, because I think we know research takes many years. So on average, it takes 17 years for research to be translated to practice. So I don't want to go too much into this, but just to let you know that there is a new thing. So scientists found this new lead. It's a protein JPR52, which also seems to reduce Huntington's disease. So if they play with this protein, it seems to have an effect on the faulty Huntington, and it has reduced Huntington's disease symptoms in mice. Okay, so it's a potential good candidate, but still early stages. And again, you know, every time you see this, it just means that you can hover, you know, in your own time and just visit if you're curious. So Pivot HD study, it's another one attempting to lower the faulty Huntington. And this is through a technique called a splice modulator. And this is a type of drug that can change how the genetic message is processed. Basically, the drug is giving dyslexia to this gene reading process. It's a phase 2 trial, again, you know, earlier stages, three different doses. It's oral, which is great, so it's not as invasive as other studies, but it seemed to affect both the good and the faulty Huntington, which we're not quite sure yet what this means, you know, how does it translate into how the person would feel. We're expecting results in the mid of this year, and I think the study is actually still recruiting, still open for recruitment in Cardiff and UCL for people above 25 years old. Again, if you're interested, just visit to find out more. So this is how it works. So I only took a screenshot of the presentation, but if you want to know more, again, there's the link. So basically, in an untreated patient, There's the production, the elevated CAG repeats produces the toxic Huntington protein. But with this splicing technique, so the drug is administered and there isn't this production of toxic Huntington. Which they don't show on the presentation is that the good Huntington is also affected. So but just to bear in mind that we don't know if the drug can actually reach the brain. So it's tough because it's an oral drug. Can it actually pass the brain barrier? And does it affect just the Huntington gene and not other genes? We don't know yet. So I look forward to hear the results in mid-2023. So SELECT-HD, it's a study by WAVE. It's a very early study, and this one is again more invasive. So the drug, which is called WVE-003, it's done through a single injection in the spine, select generation HD2, 3 different doses. And the preliminary results on this one are showing that after 85 days, the mutant Huntington is still reduced by 22%. Now, on these studies, different from the previous, because this one is only targeting the faulty protein, not the good one. So it will be quite exciting to see the results. And again, mid-2023, hopefully it's going to bring us a lot of joy. Just keep an eye on these studies. Moving to gene editing studies, which are a bit more invasive. So gene therapy is a technique that uses the genetic material to treat or prevent a disease. Unicure has done a study, it's just called AMT 130 study. And this is with people in the early manifest stages of Huntington's disease. And they're administering 1 shot of this drug guided through MRI into the brain, into the striatum, which I'll show you here. So that's the red bit in the brain. So it's quite invasive. So it's an early stages study as well. So in animals, it showed that it would lower Huntington and decrease as well symptoms of HD. People that are on the placebo are also going through the surgery, but they don't get the drug administered. And they've recruited so far 26 participants in the US and 15 in Europe. So this study was paused for 3 months because patients on the higher dose of AMT actually had serious side effects. But then in the meantime, they considered, an independent committee considered it was safe to restart the trial. And the trend suggests that the mutant Huntington was reduced by 53.8%. Now, again, it's a bit of the same message. The Huntington is reduced, but does this translate with people actually feeling better or feeling that the disease has, slowed down the progression? So we don't know yet, and the results are expected very soon as well. Another one of these earlier stage studies still in lab. So the same thing as the last one, actually. So AMT, the way they are getting into the brain is adjacent to a virus. They give the drug with a virus, because apparently viruses are very good into allocating themselves in the brain. So they're treating HD mice with the same, so still neurosurgery and a virus injection. And the drug has showed to improve motor function. And this lasted for months, the effect. So the actual symptoms of HD improved and sustainably throughout months. And this is called like CRISP, Cas9. You can see some screenshots from HD Buzz. And just in January, the authors have published another paper, which is quite scientific, and again on animal models, but basically to say that there was a change not just on a Huntington, but also on the symptoms from patients. So people were feeling better. Now, the issue with playing with genes is that does giving these drugs only affect the faulty Huntington's disease gene, or does it play up with other genes that are not meant to be touched. So it's that this is why it's hard to find such a quick fix. So somatic instability studies. So as I said earlier, so with the observational studies, we found that first, if a person has higher CAG repeats, usually it means that their symptoms will start earlier in their lives. But we also realized that individuals with the same CAG repeats were presenting the disease differently. Some were progressing quicker, others slowly. And when looking into more the lab results, we could see that the CAGs actually varied. So a person could have a CAG of 45 in the brain, and then a different part of the brain could have a CAG of 60. So it was changing. So that's why they call it like somatic instability. And some of these can increase through life. So we call it somatic expansion. So, and this seems to be the reason why on some people that although they have apparently the same CAG repeats when they do the predictive test, the disease presents differently throughout people's lives. So this has been very exciting in the research community. It's not completely new, but I would say it's the latest trend or so somatic instability, as I said, the CAG repeats in the HD gene can expand or shrink during a person's lifetime. And this repeats extension, so it increases throughout the person's life and it causes the symptoms. So what this company did, so Triplet Therapeutics, through SHIELD HD study, which is the natural history study that I spoke in the beginning, was that they enrolled individuals on this natural study. So they were not administering anything. They were just keeping track of this CAG variation throughout individuals' lives. Now, sadly, the company closed 6 months ago, but which I was a bit worried with, but actually CHDI, which is a foundation based in America, solely focused on Huntington's disease research, they've taken over the study. So we look forward to know the results, but it's quite a relief that, the patients didn't go through all this trial for nothing. And it is a very exciting area. So it will be great, again, if we understand why this instability happens, we can work on treatments. Now for specific symptom studies. So I couldn't put them all in here because there's so many, but there's some symptoms. So some trials focus on anxiety and aggression. So phase 2 studies means that they're testing it on a population that have the conditions, in this case on people that have Huntington's disease, but in a smaller group. And they're looking for, is it safe to administer the drug? And does it have any remote inclination, does it work at all? So this is phase 2. For phase 3, they actually want to prove the efficacy. It's like a make it or break it deal. And they usually expand the amount of people that they're testing it on. So you can see there's really different companies involved. There's dozens of companies now focus on finding a treatment for Huntington's disease, which is amazing because Huntington's is rare, and you know how companies tend to pursue the money. So I'm quite amazed. So they must smell that it's close. So we have treatments being developed for anxiety and aggression, irritability, and cognition, which we know, are all behavioral symptoms of Huntington's disease. Not everyone will have them at the same level, but we know people with Huntington's have these sorts of issues. And then also treatments being developed for chorea. And actually for valbenazine, so this is a phase 3 study, again, proving for efficacy. And the US has designated this as an orphan drug, which means that they're actually sort of giving them priority on the FDA to move the drug to being commercialized, so like to accelerate its development. So it's quite exciting because, you know, Korea really affects people's day to day. This is another website. So this is just for people in the UK. Again, you have the link on the top, and I'll just show you basically how it works in case you're okay. So it opens for be part of research. All right. And then let's say, so you're gonna, you know, type here Huntington's, which is what you're here for. And I'm gonna say, I don't know, yeah, Inverness is fine. And then we're gonna look for the study, and you know, you can triage it for, you know, closer to you or further from you. Oh, okay, nothing in Inverness. Let's try London, just so that you can see how it works. I don't have any favorites here. There you go. So for London, for example, you already have 6 studies here, and actually you can filter it by the studies that are recruiting. So some of them we've talked about today. So the SAGE study and ROLL, this one, the brain one, which I said, you know, they give an injections through the striatum, that's there. So anyway, you can have a look. This is a phrase I quite like from George Yorkling. He's from Huntington's Disease Society of America. And he says, we know what causes Huntington's disease. We know that we can lower the protein that we think causes HD. We just now need to figure out a safe and efficacious way, the best way to lower it. That's where we are. We will do it. We will meet that goal. So I've never seen, you know, scientists so committed to a condition. So hopefully we'll get that treatment on. And again, just to go back to my initial message, which was no research without action and no action without research. And, you know, drugs are important, but care, services, professionals are important as well. And while you may not have the drugs you wish to manage your symptoms or the symptoms from your loved ones, let's do the best we can so that you have the, you know, you reach the right resources that you need.
Thank you very much. And we'll just leave it there. So thank you everyone who's attended.
Thank you, everyone. It was a pleasure. And thank you, Huntington's Disease Association, for the invite. Thank you, John, for moderating.